I'm here with Hannah Murphy, Regional Director of Patient Access at Providence. Hannah will be joining a panel discussion on prior authorization for care taking place during our patient access meeting on July 18th. Hannah, thanks so much for being here today. To kick things off, could you share just a little bit about your background, how you got your start in healthcare, and a little bit about your role at the moment at Providence?
Yeah. So in starting with healthcare, I always knew I wanted to do something with healthcare. I grew up in the middle of nowhere Midwest, and the only thing I'd been exposed to was you became a nurse or a doctor. So I went to pre-med to become a doctor. And soon after graduating, had the opportunity to do some medical rounds in central Mexico, working in women and children's facilities and in orphanages. And coming out of that, I came back to the States and became a medical assistant working bedside. I enjoyed it, but something always felt like it was missing. And from that experience, I made some connections that then introduced an opportunity to go to corporate medical and in that leadership pathway. So with my first organization, which now is 16 years ago, which doesn't feel that long, but it has been, I had a great opportunity with some really amazing mentors to grow pretty rapidly within that organization, from project management to partnering between the acute care and ambulatory sides, to then at the end of that pathway, overseeing their surgical support services. From there, I moved up to Seattle and joined Swedish Medical Group, which is part of the Greater Providence affiliation and partnership. And now I am the Regional Director of Patient Access for Providence Puget Sound, which is composed of Swedish Medical Group, Pacific Medical Centers, Providence Northwest and Providence Southwest. And we have a wide variety of anything that touches a patient that we are looking to help better.
And one of those things is, of course, prior authorization, which you'll be presenting on it on our panel coming up in July. Might you share with us just one aspect of prior authorization that your group is finding either particularly challenging or that you're looking to improve on this year?
Absolutely. We have had an unexpected uptick in the rate of barriers and denials around certain medication groups. Right now, we're really focused on our obesity profiles for weight management. We've run into a lot of barriers in having these drugs approved for patients that we hadn't before. So we're having to do a lot of discovery around those pathways and how we can better our relationship with the various different groups to be able to bring in those drugs and accessibility for our patients when they need them.
Absolutely, and there are so many different pieces that need to align in order to secure those authorizations, and with so many new products coming onto market, I'm sure that that's quite challenging, and the patients want access to those therapies and their doctors want that as well, but it's tough.
Absolutely. We've been growing a lot of our programs around weight management for our patients, and right now the biggest boundary is we can't keep up with establishing those proper pathways to provide them with a wide variety of drugs and support to pick from that best suits their treatment plans with the rate that we're expanding our program. So we're trying to put all hands on deck to close those gaps so that it's the best possible patient experience.
Definitely. And thinking about the program more broadly, the patient access meeting coming up in July, what are you looking forward to discussing with the peers and the panelists during that upcoming meeting? Anything in particular you're looking to benchmark?
For me specifically, I think it's such a gift to be able to learn from others. In looking at healthcare, regardless of what realm you're in, we are all fighting and working towards the same true north to get the patient the right care at the right time. And why not put our heads together and learn from the best practices and share our pain points? We have so much opportunity to lean into that and see each other as partners and not competitors in the market.
Such a great point, and I know that a lot of our panelists feel exactly the same way and are really looking forward to just sharing what they're doing and hearing what others are doing to solve what are really common challenges across the industry. You know, we're all in this together, facing the same struggles.
Absolutely.
Thank you so much for coming on and for sharing a little bit about yourself with us. And we look forward to having you join us in July.
Thank you. Looking forward to it.
Thanks so much.